Pre-diabetes. It is an metabolic condition. Look at this picture, shows that glucose level chart. Diet for pre-diabetes: mainly avoid alcohol, fruits and vegetables, legumes, etc. Detail going on. Introduction. Pre-diabetes is a metabolic condition characterized by blood glucose levels that are higher than normal but not yet high enough to be classified as diabetes. It serves as a critical warning sign that one is at increased risk of developing type 2 diabetes, cardiovascular diseases, and other health issues. Definition: pre-diabetes is a metabolic condition where blood glucose levels are higher than normal but not yet high enough to be classified as diabetes, serving as critical warning sign for the potential development of type 2 diabetes and cardiovascular disease. Early intervention through lifestyle changes and, if necessary, medication can prevent its progression and associated complications. Pre-diabetes is also defined by specific glucose measurements: fasting plasma glucose (FPG) 100 to 125 mg per dl, oral glucose tolerance test (OGTT) 2-hour plasma glucose 140 to 199 mg per dl, hemoglobin A1C 5.7 to 6.4%. Types. There are no distinct subtypes of pre-diabetes, but it is often categorized based on abnormal glucose. Measurement: impaired fasting glucose IFG, elevated fasting blood glucose; impaired glucose tolerance IGT, elevated blood glucose after a meal; elevated HbA1c, reflects long-term blood glucose levels. Causes: pre-diabetes is caused by a combination of genetic and lifestyle factors. 1. Genetic predisposition. 2. Obesity, particularly abdominal obesity. 3. Physical inactivity. 4. Poor dietary habits. 5. Insulin resistance. Risk factors. 1. Age. Risk increases after 45 years. 2. Family history of type 2 diabetes. 3. Ethnicity. High risk in African Americans, Hispanic, Native Americans, and Asian Americans. 4. Overweight and obesity. 6. Sedentary lifestyle. 7. History of gastrointestinal diabetes. 8. Polycystic ovary syndrome. 9. Hypertension. 10. Dyslipidemia. Complications. Without intervention, prediabetes can lead to 1. Type 2 diabetes, 2. Cardiovascular diseases, 3. Stroke, 4. kidney disease, 5. nerve damage, 6. retinopathy. Pathophysiology. Prediabetes is primarily caused by insulin resistance and pancreatic beta cell dysfunction. In insulin resistance, the body's cells do not respond effectively to insulin, leading to elevated blood glucose levels. The pancreatic beta cells to compensate by producing more insulin, but over time they may become exhausted and fail to maintain adequate insulin levels. Signs and symptoms. Prediabetes often has no clear symptoms. However, some individuals may experience 1. increased thirst, 2. frequent urination, 3. fatigue, 4. blurred vision, 5. slow healing of wounds. Medical diagnosis. Prediabetes is diagnosed through blood test, fasting plasma glucose (FPG) test, 2. oral glucose tolerance test (OGTT), 3. hemoglobin A1C test. Nursing diagnosis. Nursing diagnosis related to prediabetes might include 1. risk for unstable blood glucose level, 2. risk for overweight and obesity, 3. risk for activity intolerance, 4. deficit knowledge regarding condition and treatment. Management. Management of prediabetes involves lifestyle modifications and sometimes medication. Lifestyle modification including diet, adopt a balanced diet rich in fruits, vegetables, whole grains and lean proteins. Physical activity. Engage in at least 150 minutes of moderate intensity exercise per week. Weight loss. Aim for a 5 to 10% reduction in body weight. Smoking cessation. quit smoking to reduce cardiovascular diseases. Medication metformin, often prescribed for individuals at high risk for diabetes. Treatment: lifestyle intervention, primary approach including dietary changes, increased physical activity, and weight loss. Pharmacotherapy: metformin may be considered, especially for those with a high BMI or other risk factors. Psychosocial medicine, addressing the psychological impact of prediabetes diagnosis is important. 1. Behavioral counseling. This involves working with a counselor or therapist to develop strategies for making and sustain healthy lifestyle changes, such as improving diet and increasing physical activity. Second, support groups. Participating in support groups provide a sense of community and shared experiences, which can be motivating and help individuals cope with the emotional aspects of prediabetes. Three, cognitive behavioral therapy (CBT) helps individuals identify and change negative thought patterns and behaviors related to food, exercise, and self-care, promoting healthier habits and reduce stress. 4. Motivational interviewing (MI). This technique involves working with a healthcare provider to explore personal motivations for change, set realistic goals, and build confidence in the ability to make those changes. 5. Stress management techniques. Practices such as mindfulness, meditation, and relaxation exercise can help reduce stress, which is important since chronic stress can negatively impact blood glucose levels and overall health. Prevention. Preventing prediabetes involves 1. Maintaining a healthy weight, 2. Eating a balanced diet, 3. Engaging in regular physical activity, 4. Avoiding tobacco use, 5. Regular monitoring of blood glucose levels, especially if there are risk factors. Conclusion. Prediabetes is a significant health concern that can lead to serious complications if left unmanaged. Early detection through regular screening, lifestyle modifications, and when necessary, medical intervention can effectively prevent the progression to diabetes 2, the diabetes and associated complications. Public health strategies and patient education are critical in managing and preventing prediabetes. Thank you. Have a wonderful day.